The sex is not supposed to be painful, it's supposed to be pleasurable. And to tell you one thing, 90% of issues can get solved by loops. There are two ways of how we look at it for a woman. For a man, there's only one way. The only way you know they are going to orgasm is by ejaculation, right? For women, you have maybe 2 or 3 or even 4 types of different orgasms. Then ideally, a good foreplay is going to confirm that a woman and a man, both of them orgasm.
What do I do when the condom breaks?
Nah, well, pray to God. No? Some men like bigger breasts, some men like smaller breasts. So it's a matter of preference. In fact, even after sexual intercourse, the chance of pregnancy of every couple to get pregnant, that is without a condom, for after they're trying for 1 year, is only around 20 to 25%.
Should you still use protection with oral sex?
I think it's a good choice. Of course, if you don't know who you're, if the other person is unknown to you, then of course, making sure that you use protection. And
How do I find the G spot?
it's $1 million question, right?
Hello everybody. So today we are going to talk to Dr. Surakshith Battina about sex. Why should not we talk about sex? Let's talk a lot about sex and a lot of frequently asked or frequently Googled questions about sex to the doctor. Come on. So doctor, before I get into these frequently asked questions, I want to talk to you about this recent movie that came up, Dr. G.
Yeah.
Did you watch it?
I didn't watch it, but I've heard a lot of it. Yeah, I've heard a lot about it. Yeah.
It was so fun. It is
Yeah.
how a guy who is into the gynac department
Yeah.
and what all he sees and everything. I was actually
Curious,
a little curious about
Yeah.
how things work in a gynac department
Yeah.
for a guy.
Yeah,
So
yeah.
how was your...
Well, my experience was quite good. I never had any problems at all. In fact, I had I would say the easy way out, So being the one, I was a other guy, so there were 2 of us.
Oh, so in your there were two.
There were 2 of us, and we always used to get away with, everything. Like all the professors never used to tell us anything. They used to catch all the girls, So yeah, that way we were very lucky.
Wow, it should have been a lot of fun.
Yeah, it was a lot of fun.
Okay, so now getting into the questions.
Yeah.
So first question is sex supposed to hurt the first time?
Oh, that's a lovely question. And in fact, I just made a video on this also on my Instagram. And the idea is the sex is not supposed to be painful, it's supposed to be pleasurable. So that is the first question when people ask. That means, yes, there's an innate issue that people do find sex painful. And we need to understand why that is so. So I think they have to get themselves investigated, or just probably try to get a little bit more comfortable with their partners to talk about why it is painful for them in the first place. And to tell you one thing, 90% of issues can get solved by lubes. So, let them use lube and definitely there will be no pain at all.
Great. Okay, second question. Why didn't I orgasm in spite of having good sex?
Yeah. So this is a very important question because not everyone orgasms. There are people who are anorgasmic. I think we were talking about this in our last episode as well. That people sometimes will not orgasm because there are 2 ways of how we look at it for a woman. For a man, there's only one way. The only way they are going to orgasm is by ejaculation, right? For women, you have maybe 2 or 3 or even 4 types of different orgasms, right? Because they can get aroused in different ways. And then the stimulation of the clitoris is one way how they get an orgasm. The other way is the vaginal, and then they have the anal. So there are so many ways of how a woman will orgasm. So you really cannot say what will really trigger that orgasm. So you'll have to try out everything to know what works.
It's all about experimentation.
It's all about the experimentation, yes.
Moving to the next question. How do I make sure I orgasm during sex? To be for man or woman?
For a man, it's quite simple. Make sure that you have enough friction, and that is definitely going to make sure he orgasms. But for a woman, I think if she had an orgasm before, and if she had a clitoral orgasm, and this clitoral orgasm takes within maybe 15 to 20 minutes, then ideally a good foreplay is going to confirm that a woman and a man, both of them orgasm.
All right. So next question is, what do I do when the condom breaks?
Now, Well, pray to God, no? But I think ideally, when this situation happens, it's very rare that it happens. Although I've seen latest, I've never heard stories of condom breaking recently because the silicone has got that good. But if it still happens, always use a double condom. That's like the best way to get yourself protected. And if it does break, I would say I would not suggest you to go in for any medications because that will definitely hamper your reproductive health. So instead of going in for medications, you just go and consult your doctor. They'll be able to advise you on what to do next.
Very well. Does penis size matter?
Again, when the topic about size, so we all know that the global average is at about 5 inches. So anything more or less, there is not you cannot say there is some significance, but then again it's like preference, right? Some men like bigger breasts, some men like smaller breasts, so it's a matter of preference. But I would say anything lesser than 5 inches or 5 centimeters, we would want to know if they are suffering from any condition or if there is something that we can do to help the man. But again, as I said, if it does not really bother him or his significant other, I think that should be absolutely fine.
Good. So, how do women have orgasm without having sex?
Yes, of course. I think self-stimulation, using toys, pleasure toys, there are several ways of how women can. And I think most women, to my knowledge, about 60 to 70% of them have a clitoral orgasm. So I think making sure they get to know their bodies better, knowing where the clitoris is and trying to understand what really helps them get aroused and get an orgasm, I think that should be the approach.
Can you get pregnant in water?
In water.
Water, like in a pool or maybe.
No, very unlikely. Very unlikely. It takes a lot of effort to get pregnant. In fact, even after sexual intercourse, the chance of pregnancy of every couple to get pregnant, that is without a condom, for after they're trying for 1 year, is only around 20 to 25%.
Oh,
Yes. So it's very unlikely that if they're going to get submerged in water and there seems to be a sperm out there, they're not going to get pregnant that way. No.
okay. So, how much masturbation is too much masturbation?
Yes, I think this is a very important question. For a man, at least, I can say that if it starts affecting their quality of life, like they're not able to concentrate on their work, or if you think they're not doing very well in school, or if in case it's going to really affect their sexual life with their partner or their loved ones, then I would say that's the time they need to take a backseat and try to reevaluate whether this excess masturbation or masturbation is really causing an effect in their life.
That
Yeah.
actually was the next question.
Okay.
Does excessive masturbation affect the duration of sex?
No, it does not. So it does not. Actually, even if they have excessive masturbation, usually it does not have anything to do with PE. But what happens is if they get psychologically affected by it, though, at that point of time, yes, PE, it can happen. When I say PE, I'm talking about premature ejaculation. That can happen to people who are psychologically affected that they masturbate too much. But if it doesn't really affect them psychologically, then usually they will not have premature ejaculation.
Should you still use protection with oral sex?
I think it's a good choice. Of course, if you don't know who you're, if the other person is unknown to you, then of course, making sure that you use protection and you're safeguarding yourself from STDs.
Of course.
Yeah.
Okay. So next question is hormone replacement therapy for menopause bad for women?
Actually, HRT is very beneficial in many ways, but I would always use HRT as my last modality of treatment because there are so many other things that people can do during menopause to counter GSM. GSM is nothing but the genitourinary syndrome of menopause, so they have issues like hot flushes, they have joint pains, and then they have high libido. So all of these things, there are so many non-surgical, non-hormonal ways to actually counter them. So in my opinion, if I have to go and give treatment for women, I will try all the modalities first, and if everything else fails, the last step will be going in for HRT treatment.
So I've never had an orgasm during intercourse. Is there something wrong with me?
Not at all, unless it is something that really bothers you and you want to really understand whether you want to have an orgasm or not. Definitely, I think going in for something like an O shot or a G shot will definitely stimulate the clitoris and possibly improve the chances of having an orgasm.
how do I find the G spot?
It's a $1 million question, right? So, I do get this question quite a lot, but then again, not all women have a G spot. It's maybe I would say around 30 to 40% of women only have the G spot.
Really?
Yes.
Oh,
The rest of the women, the G spot is supposed to be inside the vagina in the anterior level around 2 to 2.5 centimeters just above the near the urethra. So, and this you can also feel by a little bit of a rough texture in this particular area. So ideally when you put the G shot, right, what we want to do is we want to pronounce this area. So that means we want to make it larger so that whenever they have sexual intercourse, the stimulation of this area increases. So that's the whole
okay.
idea of doing the G shot. And this is only important for people who had a vaginal orgasm. And the vaginal orgasm only happens when there is enough stimulation of this G spot area. And the reason why I say not many people have a G spot, only around 30% has, because only 30% of women have a vaginal orgasm.
Okay,
Yeah,
okay, new
yeah,
information.
yeah. Yes.
Okay, so the final question is how do I increase my sex drive?
Again, as I said, the only way is by proper nutrition, diet, and of course exercise is definitely going to improve the sex drive because there needs to be enough blood circulation in the pelvic floor muscles. Many people avoid doing lower, exercises on the legs because these are very important muscles which require enough circulation. They are also large muscles, and this also helps develop more blood flow in the pelvic floor area. When this happens, automatically it is going to improve their arousals. If not, of course, reading materials or watching movies and doing couple activities are going to improve on arousals. Everyone has their own ways of how they improve it. If everything else fails, then at that point of time, as I said, no, there are things they can do like this O shot and G shot again have been known to improve arousal. I already told you like Charles Jones did this for his girlfriend. I realized that it increases the arousals for them. So ideally, I would say try it out and see if that is something that works for you, and it can help you out. Yeah.
Well, it was great talking to you, doctor. A lot of new information for us. Thank
Yes.
you so much for your time.
Thank you so much for having me. Thank you.